Did you know that you might be eligible for Medicare before turning 65? Many people assume that Medicare is only for those 65 and older, but that's not always the case. If you're dealing with a disability or a certain health condition, you could qualify early, but there are some key things that you need to know to avoid making any costly mistakes. In this video, I'll break down exactly who qualifies for Medicare before 65, how it works, and what coverage options are available. Plus, I'll share some important tips on making the most of your Medicare benefits so you don't end up paying more than you should. So stick around, this could save you thousands of dollars. Before we dive in, be sure to check out my free Medicare 101 guide, which you'll find in the link in the description below. Be sure to check that out. So who qualifies for Medicare before 65? There are three main ways you can become eligible: disability, end-stage renal disease, and ALS. Let's go through them one by one. So the most common way to qualify early is through Social Security Disability Insurance, or SSDI. If you have been receiving SSDI payments for at least 24 months, you'll automatically qualify for Medicare. But there's a catch. There's a 2-year waiting period after you receive your SSDI approval before your Medicare coverage can begin. I'll explain more about that in a minute. The second way you can qualify early is if you have end-stage renal disease, or ESRD. This is a condition where your kidneys have failed and you need regular dialysis or a kidney transplant. If you have ESRD, you don't have to wait the 2 years like SSDI recipients. Your Medicare coverage usually starts within 3 months of beginning dialysis or immediately after a kidney transplant. And finally, if you've been diagnosed with ALS or Lou Gehrig's disease, you'll automatically qualify for Medicare as soon as you start receiving SSDI benefits. And there's no waiting period at all. Now let's talk about that 24-month waiting period for people receiving SSDI. This is something that catches a lot of people off guard, so it's important to understand how it works. The waiting period begins the first of the month you start receiving SSDI payments, not the date you are approved for disability. So if it took a while to get your SSDI application approved, that time doesn't count. And you must receive your SSDI payments for 24 consecutive months before Medicare coverage begins in the 25th month. So are there any exceptions? So like I mentioned earlier, if you have ESRD or ALS, you don't have to wait the 24 months, but for most SSDI recipients, this waiting period applies. One of the biggest challenges with the waiting period is the potential gap in health insurance coverage. If you had employer-sponsored insurance before going on SSDI, you might lose it. That can leave you scrambling for options. So what can you do? Well, there are a few alternatives. You might be able to stay on COBRA, but that's often very expensive. Another option is getting coverage through the Affordable Care Act marketplace, as these plans can be more affordable to help bridge the coverage until Medicare kicks in. If you have any questions or you're looking for health insurance, give us a call at the number below or use the link in the description to book an appointment with us. We'd be glad to help you out. So once you become eligible for Medicare, you'll get the same coverage as someone who enrolls at age 65. That means you'll get Medicare Part A, which covers hospital stays, and Medicare Part B, which covers doctor visits and outpatient care. And also, you have the option to enroll in Medicare Part D for prescription coverage. But there's one big difference if you're under 65, and that's with the Medicare Supplement or Medigap plans. These plans might not be available to you. In some states, insurance companies aren't required to offer Medigap plans to folks under 65. And in some states where they are available, the premiums can be much, much higher than if you were 65 or older. So what's the alternative? A Medicare Advantage plan could be a good option if you're under 65. Medicare Advantage, also known as Part C, combines hospital, medical, prescription coverage all into one plan. It actually takes over your Medicare and becomes primary. But these plans often also add extra benefits like dental, vision, hearing, and fitness coverage as well. If you're looking to compare Medicare Advantage plans, give us a call at the number below or use the link in the description to book an appointment with us. We'd be glad to help you out, and our services are 100% free. Now, what happens when you turn 65? So let's say you're on Medicare under 65, and then you turn 65. Now, this is actually a big deal because when you turn 65, you'll get a brand new enrollment period where you can purchase a Medicare Supplement plan, no health questions asked, and at the regular pricing for someone who's 65. And if you're in a state where the Medigap plans aren't available or the insurance carriers are charging more, then you'll be able to get a plan, again, no health questions, and at the normal pricing. So let's do a quick recap. Some people qualify for Medicare before 65 if they're on SSDI for at least 24 months, have end-stage renal disease, or ALS. If you're on SSDI, there is a 2-year waiting period before your Medicare coverage kicks in, unless you qualify through ESRD or ALS. When you get Medicare, you'll have access to Part A, Part B, and the option for Part D, but Medigap plans may be limited depending on where you live. So Medicare Advantage plans, also known as Part C, could be a good alternative. And finally, once you turn 65, you'll have more options available to you, including Medigap plans with guaranteed issue rights, and that's the perfect time to reassess your coverage and make sure you're on the best possible plan. So if you're under 65 and wondering what your Medicare options are, don't navigate it alone. There are lots of details that can impact your coverage and costs. Making the wrong choice could end up costing you thousands of dollars. We specialize in helping folks just like you find the right Medicare plan for their needs. So give us a call at the number below or use the link in the description to book an appointment with us. And we'll go over all your options and make sure you're in the best possible plan for your situation. If you like this video, be sure to click like and subscribe to stay updated on all things Medicare. Thanks for watching the video, and we'll see you on the next one. Thank you.